We look at how hypoglycemia can be able to cause heart failure in children. All right, so let's just try to understand the topic. Hypoglycemia is, I'm trying to say, glucose levels in the body are low. Glucose levels in the body are going down, right? So if somebody doesn't have enough glucose, can it cause heart failure? Now you'll be thinking, yes. Do you understand? But you don't really know a clear linkage between the two. All right. So let's look at a clear linkage between the two, so that even if you are asked in an exam hall, you can be able to put it out in writing. All right. So hypoglycemia just simply means glucose levels in the body going down. So how can it lead to heart failure? So as an introduction, hypoglycemia is what? Low glucose levels. It can contribute to heart failure in children, all right, particularly in critically ill children or metabolic disorders. So while it is not a common cause directly, okay, it can impair heart function. Do you understand? So if you have any other heart issue plus hypoglycemia, then heart failure progresses faster. Do you understand the link now? So glucose, we are trying to look at why is it actually very important to the heart muscles. It's the primary energy source of the heart muscles, all right, also the brain. Okay, so in children, especially infants, the heart is highly dependent on glucose to maintain your normal contractility and how the heart is beating, lob dub. So when glucose levels drop, the heart muscles, they are struggling to function. So what are the different linkages between hypoglycemia and heart failure? So first, the energy supply to the heart muscles is being impaired. So low glucose means less energy for the heart muscles. So it can lead to reduced cardiac output. The heart is beating low. That's bradycardia. It could also lead to what? A cardiogenic shock in severe cases. Okay, let's move. Autonomic dysfunction. So hypoglycemia triggers a stress response. So there's a whole lot of adrenaline and cortisols. So it's now making the heart beat faster. So it's stressing the heart a lot. All right. Then the heart is not beating normal. That's arrhythmias. All right. So because the cardiac muscles are working more, they are demanding more oxygen. So if this person is also having issues with breathing, the heart muscles are working faster than faster than the food you are supplying them, then there'll be a war there. Do you understand? So if prolonged, they exhaust the heart and makes it faster for heart failure to come in. Electrolyte imbalance. So it often coexists with hypokalemia, that's low potassiums or acidosis. This can impair cardiac conduction, increases the risk of the heart beating abnormally, okay, and contracting abnormally, okay. So underlying conditions, sometimes the child has inborn errors of metabolism, congenital hyperinsulinemia, then critical illness. All of this may actually, be the reason why they are having hypoglycemia. So hyperinsulinemia could be that you have too much insulin. Insulin makes the cell uses of glucose. Do you understand? So always your cells are using glucose too much. That's what is actually making that glucose is actually less in your body. Do you understand? So these conditions can lead to multi-organ failure, including the heart can fail in such conditions. Okay, so that's it.